An emotional plea today from the CDC director warning governors about the link between state rollbacks and a rise in COVID-19 cases. Here to answer your questions is Dr. Sharon Wright, Chief Infection Prevention Officer at Beth Israel Lahey Health. Good to see you.
Good to see you as well.
So today, Dr. Rochelle Walensky, she put aside those prepared notes to tell people she's worried. This was her quote about impending doom if they stop following mitigation measures, masking, distancing. Do you share those concerns?
It's a tricky time right now, I would say. On the one hand, we are so close to being able to get more and more vaccine into the Commonwealth every week and get more and more people vaccinated. But on the other hand, we're seeing for several weeks in a row now the numbers of people who are acquiring COVID creeping up. So I think it's a little bit of a dangerous time. We're seeing more variants in the state. And while more people are protected, we're just not quite there yet. So I agree with her that we need to keep doing what we've been doing the whole time, which would be masking, physical distancing, cleaning hands, and trying to stay mostly with members of your household or in your bubble.
So she says she plans to speak with governors tomorrow, Dr. Walensky does. What do you think her message to public health officials in Massachusetts should be?
I think, again, to keep doing what we're doing and to get people vaccinated just as quickly as we can. I think the more vaccine that we can get into people's arms and the more campaigns that we can put out there for the public and have outreach to those people who really, really need to get vaccinated. I think that's the best protection that we can have for everyone.
So we talk about the vaccines. The CDC released a new study today looking at how well the Moderna and the Pfizer vaccines prevent infection in the real world. What did this find? Tell us about this.
I think it's a really great study to have right now because it shows us that the vaccines do really work well. In a real world study, they looked at about 4,000 healthcare providers from the middle of December through the middle of March, so during a time period at which variants were circulating, and found that after one dose of vaccine, 2 weeks later, when people are partially protected, they were 80% effective for the mRNA vaccines, the Pfizer and Moderna vaccines. And after the second vaccine, they were 90% protective. So that's really good news.
When we talk about the CDC, today they added 2 new medical conditions to the list of comorbidities at high risk for severe COVID disease. The first is type 1 diabetes. The second, substance abuse disorders. We're working to find out if the state is going to prioritize these groups as well, add them to their list. But what is your message to people with either condition?
I think the message has been the same the entire time. If we didn't have such a shortage of supply, we would say that everyone should get vaccinated right now. And so it's really just been a matter of prioritization and not who should get vaccinated and who should not. The initial CDC list was really based on the data because they're trying to stick to the science. So they prioritized people who had from populations or with conditions that had been well studied. And now as more time's gone by, more and more conditions that people have been studied. And so the expectation would be that all of these groups will start moving up into the list. I honestly think that since we will be opening up to all adults and people over the age of 16 in the state by April 19th, I think that soon this won't become as much of an issue.
Right. All right. Dr. Wright, thank you for your insight. We appreciate it as always.
Thanks for having me.